Why Talk Mental Health Therapy Isn't the Right Tool for Every Brain by Dr. Randy Kale for Capital District Neurofeedback. When therapy doesn't work, or never felt right to try, many people quietly arrive at the same conclusion after months or years of genuine effort. Therapy didn't work for me. Others never begin at all, not because they are afraid of mental health care, but because they instinctively sense that talking about their problems won't change how they actually feel. These reactions are often mislabeled as resistance or avoidance, yet clinical data and long-term outcomes tell a more nuanced story. A sizable group of people do not experience lasting change with talk therapy alone, and an even larger group senses this before they ever schedule the first appointment. Psychotherapy can be extremely helpful for certain challenges, particularly those rooted in life transitions, relational patterns, grief, and meaning-making. But the cultural assumption that therapy works for nearly everyone if they simply stay the course does not match the research. Large reviews consistently show that 20 to 40% of clients drop out of therapy early, and some analyses suggest dropout rates approaching 50% depending on diagnosis, setting, and therapist factors. Most people do not leave because they lack motivation. They leave because they do not feel meaningfully better. Just as important is the population that never enters therapy in the first place. Surveys and qualitative studies show that many adults avoid therapy not due to stigma, but because they already understand their story well enough to know that insight has not translated into relief. These individuals are often self-reflective, psychologically minded and motivated, but their distress feels automatic, bodily, and resistant to reasoning. For them, the question isn't, why do I feel this way, but why doesn't my system calm down even when I understand everything? How common is it for therapy not to work? Research across multiple clinical settings shows 20 to 40% of people drop out of therapy prematurely. Some large-scale analyses show dropout rates nearing 50%, 10 to 15% report dissatisfaction even after completing treatment, 40 to 60% relapse within 1 to 2 years, especially for depression and anxiety. Many never begin therapy because they sense talking won't help their symptoms. This data reveals something important. Therapy. Non-response is not rare or exceptional. It is common enough to deserve better explanations and more options. Here's another thing to ponder. Why insight often doesn't change how you feel. Even among people who complete a full course of therapy, long-term follow-up studies are sobering. For common conditions such as depression, anxiety disorders, and trauma-related symptoms, 40 to 60% of individuals experience a return of symptoms within 1 to 2 years. This recidivism occurs even after successful treatment and often surprises clients who believed insight would produce durable change. The reason becomes clear when we understand how symptoms are generated. Many mental health conditions are not primarily problems of motivation, meaning, or awareness. They are problems of brain and nervous system regulation. When the brain becomes stuck in patterns of over-arousal, under-arousal, or rigidity, it continues to generate anxiety, low mood, emotional volatility, sleep disruption, and cognitive fog, regardless of how well a person understands their past. Clinically, this shows up in familiar statements. I know why I feel this way, but it doesn't change how I feel. That statement is not a failure of therapy or effort. It is a clue about mechanism. Talk-based approaches rely heavily on top-down processes, reflection, cognitive reframing, emotional processing. Dysregulated brains, however, operate bottom-up. They react before thought, often at a physiological level that conversation cannot reach. Interestingly, many people sense this from the beginning. When someone says therapy isn't for me, they are often describing an intuitive awareness that their symptoms are automatic, bodily, or state-based rather than narrative-based. These individuals frequently report that talking makes them more aware of distress without changing it, or that they leave sessions understanding more but still feeling the same. That intuition deserves respect, not correction. Let's consider talk therapy versus brain-based regulation. Talk therapy is insight-driven, works through reflection and understanding, relies on cognitive and emotional processing, helps many people, but changes are sometimes temporary, vulnerable to relapse when stress returns. In contrast with neurofeedback, we see science-based and learning-driven works by training brain regulation directly, targets the underlying physiological patterns designed to create lasting change in how the brain functions, often helpful for people who did not benefit from talk therapy. Outcome literature often rates neurofeedback as best treatment. This distinction explains why many intelligent, motivated people say, "I understand myself, but I still don't feel better," and end up considering neurofeedback to get the change they want. What does neurofeedback do differently? Neurofeedback works directly with the brain's electrical activity, helping the brain learn more stable and efficient patterns of functioning. Instead of trying to manage symptoms, the goal is to help the brain stop generating them in the first place. Over time, the brain learns regulation through feedback, much like learning balance on a bicycle. The scientific literature supporting neurofeedback spans several decades, with strong evidence for ADHD, anxiety disorders, PTSD, sleep disorders, mood instability, and performance challenges. Importantly, neurofeedback addresses the underlying driver of relapse seen in long-term therapy studies. Persistent dysregulation. When the brain becomes more stable, symptoms often diminish without constant effort, coping strategies, or ongoing interpretation. Why does neurofeedback often help? When therapy didn't? Many clients who felt stuck in therapy noticed something very different with neurofeedback. Sleep often improves first. Emotional reactivity softens. Recovery after stress becomes quicker. Focus sharpens. Across weeks, the system begins to feel more grounded and less vulnerable to the unexpected. At that point, therapy, if continued, often becomes more effective, more efficient, and more personally meaningful. For others, neurofeedback alone produces the relief they've been seeking for years. This pattern is not mysterious. When the nervous system calms and stabilizes, everything else becomes easier: thinking, feeling, relating, and even resting. When the brain is dysregulated, no amount of insight, motivation, or coping strategy can reliably override its automatic responses. I want to emphasize, this is not anti-therapy. It's pro-precision. Certainly, mental health therapy remains valuable when the challenge is meaning, relationship patterns, grief, or life direction. But when symptoms persist despite insight, effort, and understanding, it is often a sign that the brain and nervous system need direct support. Neurofeedback does not require you to relive experiences, analyze your past, or push yourself to feel differently. It works by helping the brain learn regulation at a foundational level, so calmer, clearer states become more natural and less effortful. If you've tried therapy and felt discouraged, or if you sensed from the beginning that talk alone wouldn't help, your experience matters. You're not broken, resistant, or avoiding growth. It may simply be time to explore an approach that works with how your brain actually functions, rather than asking it to override its own stress responses. The most helpful next step is not commitment, it's clarity. A thoughtful consultation allows us to understand what you've tried, what hasn't worked, and whether neurofeedback is a good fit for you. There is no pressure and no obligation, just an informed conversation about what might truly move things forward. If you're ready to take that step, you can schedule a consultation directly through our website or call Capital District Neurofeedback at 5186-063805 to speak with our team, and they will set up a complimentary consult with me, Dr. Randy Kale. We can discuss where you are at, cover your questions, and then decide if neurofeedback is the right path for you. No pressure, just time with a seasoned psychologist helping you to understand your options. Sometimes the path forward isn't about doing more. It's about choosing differently with guidance.
This has been the NeuroShift podcast. The episode description includes a link to contact Dr. Kale. Thank you for listening, and stay tuned for our next episode.